this fantasy that as therapists, as we continue to study how important it is for neurodivergent people to unmask, that we start to think about how we can make unmasking possible in the therapy room. And I think it's a pretty big question because the structure of a therapy room is basically like neurotypical, like dream suite. It's like two people sitting, talking to each other, presumably knowing what social cues are coming next with all these odd silences and not knowing who's thinking what and trying to guess. And there's not a lot about the process that's inherently transparent. So I'm thinking lately about how to make clients feel like they can safely unmask. The most obvious is to say, how can I help you to unmask? Transparency and being really clear about the invitation to unmask feels like an essential step in the process towards creating a safer environment for neurodivergent clients. Secondly, you might need a dry erase board with a list of the topics that you're going to discuss so that it's obvious and predictable and tangible and not totally scary, like I have no idea what this person's going to say to me next. Third, there has to be space provided to talk about the client's special interests. And if the therapist, who is possibly neurodivergent too, they should be able to talk about their special interests because it's what makes conversation between neurodivergent people so rich and interesting. And I guess last, I would suggest that you ask the client how open-ended questions versus closed-ended questions feel to them. And if open-ended questions create a tremendous amount of anxiety, which is the form of questions that therapists have been trained to ask, then we can't keep doing them because it makes the client more anxious, and we're here to calm them down.